Hey, everybody. Oftentimes, people and families tell me the same thing, that they weren't ready for the shock of going into the emergency room with their loved one who's experiencing dementia. Because really, ERs are built for medical emergencies, not for cognitive emergencies. So, in this video, we're going to talk about how to prepare for an emergency room visit if you ever have to go. Hopefully, that's not the case, but after this, you will have a sketch, have a playbook to start working on so that you're prepared if you should have to take your loved one to the emergency room. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, and I've been partnering with the Council on Aging in St. Tammany for over 11 years as their caregiver support group facilitator, as one of their educators, and as bringing you this caregiver coffee conversation for many of those years, about half of those years. Today's a really important topic. It is based on the Alzheimer's Association 2025 Dementia Care Practice Recommendations. And if you've seen a bunch of these videos, you know that I pull a lot of information from that publication. In this one, it includes emergency department transitions and acute care. Best practices for dementia-friendly emergency care are informed by the Hospital Elder Life Program, or HELP, developed by Inouye and Associates, the gold standard for delirium prevention. Additional recommendations come from the National Institutes on Aging, the Hartford Institute on Geriatric Nursing, and the Institute for Healthcare Improvement, or IHI, all of which emphasize communication, environmental stability, caregiver presence during emergency care. And I'll have a list of these resources and sources in the description of this video. Before we get started, just if you've seen these before, you know I give a little spiel about our caregiver support group. We meet every Tuesday evening, unless it is a holiday. We go from 6 p.m. to 7:30 p.m. Sometimes we're in person in Slidell or Covington, and the other weeks of the month, the other Tuesdays of the month, we meet virtually on the Zoom platform. If you go to the coastseniors.org website and you navigate over to caregivers or caregiver services, you'll see that we have a 12-month calendar flyer where you can see where we are for those 3 months, and when some new months roll around, we publish a new one. So you always see exactly where we're going to be. You see the address. You won't see the Zoom links. To get that, you'll need to join the free email reminder that I send out every Tuesday morning. The information on how to do that is also on that 2-month calendar flyer. So once you do that, you get reminders every Tuesday, and then if it is a Zoom Tuesday, you'll receive the link to that, and it never changes. The Zoom link is always the same. All right, with that done, let's get into this important topic of the ER, how to prepare for it. There are a lot of tips that we'll be presenting. Please don't feel overwhelmed. Just know that you can always pause and come back. You can watch it again if you want to. I do recommend having a notepad so you can jot down some of these tips, and just give yourself some time to develop this. Don't think you have to do it in the next 48 hours or spend a lot of money or anything like that. It's more like just time and intent, and knowing, I think understanding the why behind this is important, because, well, it's your loved one. It's important that's why it's important to do this. All right. So why is the emergency room especially hard when someone's living with dementia? Think about it. You've probably been there before. The bright lights, the loud noises, the constant movement, overwhelming sensory input, long waits with no routine or predictability, rapid staff turnover, unfamiliar faces, which can sometimes cause anxiety, the risk of delirium, especially if there is an infection, dehydration, or sleep loss. Caregivers often feel unprepared, and they arrive unprepared because these emergencies happen suddenly. So let's talk about the ER go bag first. Go bag as in G-O bag. All right, so we're going to talk about items for the person who's living with dementia, and then we're also going to talk about items for the caregiver or care partner. All right, so starting with the person who's living with dementia, medication list that is current and that is printed. Legal documents, so if there's a power of attorney, an advance directive, living will, things like that, have copies of that ready in the go bag. Glasses, hearing aids, dentures. Some of these, well, I was going to say duplicates. It's not expensive to get duplicate glasses, especially online with like Zenni Optical, but it would probably be expensive to have spare hearing aids and dentures. But just find a way so that they make them in the go bag when you have to go, even if at a moment's notice. A familiar blanket or sweater. Comfort items. This could be photographs. It could be prayer card. It could be a rosary. It could be a teddy bear. There's a number of things it could be. Things that are meaningful and provide comfort. Let's see, snacks, things that are easy to chew, things that don't have to be refrigerated, things that are familiar. Non-slip socks. Now, you could get these at the hospital, but I don't know if everyone in the emergency room gets it or if this is only if you get admitted into the hospital. But non-slip socks are important. Think about an about me sheet, like a one pager that has preferred name, that has communication tips, that has mobility needs, that has behaviors and expressions to watch out for and what they mean. Things that make me feel comfortable, and baseline cognitive status. So this one pager is something that you can hand to the medical provider, whether it's a nurse or a doctor, somebody in between, and kind of give them a good baseline and help them to know that person, pretty quickly. I'd even put stuff like anything significant, like served in the military, favorite sports team is XYZ. Things like that. They're going to help that person get medical information, help the provider get some medical information really quick, but also get to know that person. As a person, you want them to see your loved one as a person, and you just want to make that easy. All right, items for the caregiver. Your phone, of course, phone charger, a long charging cable. We're talking like 6 to 10 feet. You might have like what are they called? They're called like a tap, but you plug it in. They're like $4 from Home Depot. You plug it in and it's got it turns one plug into 3 outlets. So that can come in handy, especially if other people are trying to use outlets. You're like, hey, here, I'm providing this. I'm not taking up a spot. I'm actually providing more outlets with that. A portable battery pack you can get off of Amazon and other places. Comfortable clothing like sweatpants, hoodie, things like that. A small blanket, water bottle. Of course, you want to have that for your loved one also. Water bottle, I mentioned that before. Snacks for you, a notebook and pen, a folder for paperwork and keeping that all organized. Of course, you're gonna have the POA and all these things in other folders with you. So being prepared and having this bag makes the reduces panic and helps protect dignity for both you and your loved one with dementia. All right, what to say in the ER to the staff. And this is what we're aiming for is advocacy without being pushy. Okay, we want to be persuasive. We want to be respectful. We want to be calm and clear. So here are some examples of statements that you can borrow. So you can rewind these, listen again or jot these down or whatever you are comfortable doing. So one is, my loved one has dementia. You can even tell them, if you can tell them what type of dementia. You can tell them that they're at a high risk for delirium. You can ask questions such as, can we keep the lights low? We're going to talk about like what you can do to kind of buffer some of these sensory things if they can't lower the lights. But we want to ask. Ask if you can stay with them. That's really important that you're able to stay with them. During COVID, that was a problem. I don't think that's a problem now. Shouldn't be. Please avoid any sedating medications unless absolutely necessary. Um, based on what type of dementia, you want to make sure that they're not given certain medications. So if your loved one has Lewy body dementia, there are certain medications you must absolutely make sure are not given uh, to someone in the emergency room if they're trying to calm them down. That can be, that can be devastating. But be prepared and know what those are. Um, Ask what is the safest option for someone with a cognitive impairment. So there might be some mitigating things that they can do right away if they know that, if they know that your loved one has a cognitive impairment. And then is it possible to reduce noise if possible? So we're not being confrontational. Advocacy is about collaboration, standing firm, but still showing giving respect to those that are providing the services to you. So some tips on how to keep your loved one calm in the emergency room. So we talked about those familiar items. This is why we bring them: the blanket, the photos, the rosary, the teddy bear, the pillow, things like that. Speak softly and slowly. Offer reassurance, like use words like "you're safe," "I am right here," "I am not going anywhere." You could possibly play calming music on your phone, so meaningful music. We've talked about that before, or just something that is soothing to them. Reduce stimulation, dim the lights, close the curtain if they have one. Avoid over explaining things. Try to keep it just very simple and try to keep your stress um, as hard as it could be. Kind of try to keep your complaining and your stress within you to not stress them out, because they're going to, and I think we've talked about this in past videos, they're going to kind of feed off of your demeanor. So you want to try to be as calm as possible, as difficult as that could be. It could really help them, and then that in turn can help you. The calmer they are might help you as well. All right, so what if we can't control the environment? And of course we can't control the environment, but what I mean is, what if they can't dim the lights for us? What if they can't lower, the noise and the chaos that's in the emergency room? So here's some suggestions to consider. For bright lights, have a baseball cap or other soft brim hat that can, it's going to provide some coverage from those bright fluorescent lights that are overhead. Light tinted glasses, such as amber or rose color. And while I suggest that, you probably want to avoid sunglasses, which could be way too dark and cause even more confusion, as they're getting too little information at that point by having dark sunglasses. But they may even ask for those sunglasses, so you'll just have to see. For noise, um, foam earplugs, because they still may allow hearing the staff. Of course, they're muffled. They may not be very comfortable, but that's just something to consider. So the cheap foam earplugs, you roll, like you pinch and you roll, and then you put them in and they expand. So your loved one may or may not be comfortable with that. It may be too muffled, but it is an idea, and it's very inexpensive. Think about noise reducing earmuffs. These are soft, non-industrial ones. I've seen children at sporting events with these on, and to kind of help keep them calm in a very stimulated place. And no, I'm not saying that persons living with dementia are children, but we're trying to accomplish the same thing, to keep them from getting overstimulated. And they may be fine with it, but that's also something you can check before you go to the ER, is try these earmuffs out to see what they think about them. You can even think about a white noise app on your phone. So playing rain, crickets, the ocean, things like that, nature sounds or white noise. For just basic overstimulation, if possible, face the chair away from busy areas. Create a blanket cocoon over the shoulders, unless they're going to feel claustrophobic, of course, but it's something to try. Limit explanations to reduce the cognitive load. So we mentioned that earlier, is you just just speaking calmly and plainly to them, not giving too much information, being succinct in what you're saying, speaking slowly so they can process it as well. So the whole idea behind that is when you can't change the environment, there might be ways that you can buffer it. And then as we get towards the end of this video, if there's a possibility that the emergency room visit can turn into an admission depending on what is happening. And we're going to have a part 2 to this video that you're listening to right now. So the environment changes dramatically. It can be quieter but more disorienting. The nights, if overnight, are especially confusing, and the staff rotate every 8 to 12 hours. So the idea of where we kind of shift when we're looking at an overnight situation or admission situation is the idea is going to be to reestablish orientation as soon as possible. So that's using a clock, that's using a calendar, photographs, a familiar blanket that you're already going to have, music that you assumably already have, and things like that. So that's just all kind of general things that we'll talk about in the next video. You want to ask for the delirium prevention protocols and prepare yourself for a temporary worsening of confusion. This can be normal in a hospital environment. So we can't control the emergency, right? But we can control the degree of readiness that we have. We can control the preparation that we talked about, all these things. So my suggestion is sort of pick a handful of things that you already have available, build that kit. You may have a bag already just in your closet. Make that your bag. You don't have to go out and buy something unless you really want to. Then there's always Goodwill. They usually have backpacks and things like that. So you get your bag and you start putting stuff systematically in there, starting with things that you have, and then look at the things that you need to purchase and just find good deals on them. Because ideally, you have this bag and you're not going into that bag for things on a daily or weekly or even monthly basis. This is just the bag. That's why I was saying you could get a duplicate, or you can get a spare pair of glasses pretty cheap online with the prescription, and that could live in that go bag. So the dentures and the hearing aids can't do that. It's not practical to buy spares of those, but the idea of the go bag is that as much as possible would just live in there until it's ever needed, and maybe it's never needed. So ER visits are stressful, but preparation can bring peace. The dementia-friendly plan protects safety, dignity, and your calm and their calm. And when you are your loved one's voice in the ER, you are not alone. They are not alone, and you are not alone. So I hope this was helpful. So if that ER visit turns into a hospital admission, and sometimes it does, the environment will change again. It may be less chaotic, but there's going to be some overlap of the ER, and when you're being there for a long-term or at least a couple night stay that you'll be prepared for. So we're going to add some more things and talk more about that in the next video. So I hope this was helpful. I hope you found a handful of things that you can start working on, especially that go bag, and look forward to having you join us for the part 2 of this in the next video. Take care until then.